Happy May 1st, everyone. I cannot believe April's already over. Let's hope the April showers are done. I think we all have had enough rain and our lakes are definitely filled up to the brim. So I don't have much new information, Life Circle specific information this week to report. Heidi and Kelly have been doing a great job in keeping you all up to date with policy and guideline changes, and our PPE supplies are healthy and there for when we need them. And all of our team members remain infection free, so that's wonderful. In Michigan, there were 980 more confirmed cases between Wednesday and Thursday of this week. So we have a total of 41,379 confirmed cases across the state. And the number of people who died from COVID-19 also increased, this time by 119 people between Wednesday and Thursday. So far, 3,789 of our fellow Michigan citizens have died from COVID-19. My heart really goes out to all of their families and loved ones, and really all of the healthcare providers who have had to be by their side because family couldn't be with them as they passed. Even though Michigan ranks number 7 in total confirmed cases across the United States, we rank number 4 in deaths. So that tells me that Michigan obviously has a higher death rate from infected individuals, and I'm not really sure what that's about. Maybe it's that not as many people have been tested, but we'll continue to watch those statistics and try to figure out what that's about. The number of COVID-19 cases in Muskegon, Ottawa, and Allegan counties also continues to grow. It appears to be impacting more younger people than older adults. And my theory is that younger people aren't necessarily practicing social distancing as strictly as their older counterparts. However, Life Circle's participants are doing very well, so please keep up the great work at protecting them from this deadly virus. So far, our hospitals in Muskegon and Holland are also doing well. There are very few COVID positive patients and only a handful of them in critical care or on ventilators. And that's at both Mercy Health, Holland Hospital, and Spectrum Health Zealand. We are finalizing our fiscal year 2021 budget. And as I've mentioned before, planning for a reduction in revenue from having less people enroll in the coming months is our biggest challenge. Sarah and Amy and Alyssa really have very difficult jobs right now. Imagine trying to explain this incredible program to seniors and their families when we cannot bring people into the day center. We cannot have them interact in person with any of you, so they can't see your smiling, warm, inviting faces. We can't provide much home care, and they really don't get a feel for what the whole program is all about during this pandemic. So we have to keep trying, though. Our enrollment and marketing team will be trying to get the word out in different ways to help increase our enrollments. And I just ask each of you to please make sure you are sharing all of the wonderful stories about our program, share on social media and word of mouth. And we are always looking for new ideas and untapped referral sources or different and unique ways to explain this program to people. So please don't hesitate to share your ideas. Share them with Amy or Sarah or Alyssa or really anyone. We just need to do our best to try to get the word out. Also, I do want to take a moment to reflect on all of our fellow healthcare and long-term care professionals who work for facilities or institutions that have been so badly hit by the coronavirus. So many of these individuals in the institutions they work for are being unfairly treated by the press and the public. And many frontline workers are needlessly suffering. So my heart really goes out to our colleagues and their families, and it makes me feel even more grateful for being part of Life Circles. I feel fortunate to be part of Life Circles, where we were able to quickly adjust our care model to meet the needs of our participants in new and effective ways. This creativity will need to continue, and it is not going to get easier. So please continue to care for yourself and each other so that we can persevere in the coming weeks and months. Our entire health system is drastically changing, and our ability to quickly adjust and reset will be crucial to our ongoing success. There is literally no more of the way we've always done it. I think that we are going to be challenged in new ways to make decisions quickly and to respond to whatever comes our way during this crisis and even after the crisis. I think there's just going to be a lot of changes all across the system. So for some of you, this is scary and anxiety provoking. For others, it is energizing and exciting. I'm sort of in between, truth be told. And as with all of us, some days are pretty darn hard. But what motivates me is knowing that I have 130 plus employees and contracted associates that are fully engaged and ready for the call to action. I am so incredibly blessed to serve this wonderful team, and I am so grateful to have you by my side. So as we go into this warm weekend, please remember the difference you can make each time you positively interact with a teammate or a participant or their family member, a peer who's working for one of our community partners, a friend who is struggling, or even a stranger with a mask on who you can't see their mouth, so you don't know if they're smiling or frowning. Smile at them with your eyes and give them a head nod. They'll appreciate it. So thanks for all you do. Have an incredible weekend, and we'll get back at it next week.